whole hand, and the pain aggravates more in the night. And sir, apart from that, patient got debridement of the index finger, and the recurrence happened again after 1-2 weeks. We received the patient in the OPD with the complaint of discoloration of the index finger associated with the pain.
Okay, you see, whenever you get a patient who has blackening of the fingers or toes, it implies that there is compromise of the blood supply. So, in this case, you are suspecting that probably there is compromise of the blood supply. So, what are the common conditions in which you expect the compromise of the blood supply?
Mainly, sir, peripheral vascular disease.
Peripheral vascular disease. So, what are the common peripheral vascular diseases?
Sir, mainly in the upper limb.
You start with the lower limb.
So, lower limb Berger's disease, sir.
Berger's disease for young patients.
Young patients.
Yes.
And the patient is having history of smoking for 20 years.
Yes. So that is again a contributory factor for any peripheral disease. What else? Other than
Atherosclerosis.
senile atherosclerosis is another one. Then any other? Pre-senile atherosclerosis. Okay. So now you have these important conditions. Then there is diabetic. So diabetic atherosclerosis and diabetic disease will also cause, but it is a wet gangrene. So in this case, it appears to be dry gangrene. So now, with this history, we do an examination. So what are the examinations required for this case? You have taken the history that is a chronic smoker. And he is having pain in the upper arm, and there was some blackening and some debridement was there. But there is no history of pain in the lower limbs. So in Berger's disease, it is typical presentation that the pain starts from the lower limb and then affects the toes. And the pain is in the calf muscles, which is known as intermittent claudication. What is intermittent claudication?
So the patient walks when he sits, and while walking, the patient is having the pain. When the patient rests, the pain gets subsided.
So intermittent claudication is the initial presentation when there is hypoxia to the tissues. So when this hypoxia, the intermittent claudication, the claudication distance increases. So first say there is pain starting at 100 meters. Then the pain will start at 50 meters. Then it will start at 10 meters. So after that it will be converted to rest pain. So rest pain is another progression of the disease. So the compromise of the blood supply will enhance and it will completely narrow the blood vessel because of the inflammatory process. So in this case there is no history of intermittent claudication and there is no history of involvement of the lower limb. So now the reason is what are the possible causes of the involvement of the upper limb in this. So the one of the important ones is, as you said, the Raynaud's disease or Raynaud's phenomenon. But majority of patients with the Raynaud's phenomena, they are females. And there is a bilateral condition, both the limbs are affected. And there is change in the color of the fingers. So that typical history is not there. Cold exposure, and then use of those machines, high grade drills. So all these causes vibration and can cause the minor vessels to get occluded and resulting in gangrene. So that history is again not there. Then the third thing is cervical rib. Cervical rib is one of the conditions in which there is a test which is known as the Adson's test, in which there is change in the direction of the vessel and there is compromise and the pain starts. So that test can be done in this case. The other is Scalenus anticus syndrome, in which the blood vessel gets obstructed and there is the compromise of the blood supply to the upper limb. And then there is there are certain autoimmune disorders, SLE and many other autoimmune disorders. So if you go to the history, you have few things which must be noted. One is it is the case of lower limb and upper limb involvement, or it is only upper limb involvement. Is he having any neck pain which is typical of the cervical grip, or there is any previous history of autoimmune disease? Let us first start the examination. In the examination, what we have to see is overall general condition, vitals. So the first thing is to see for the pulses. So let us see the pulse. Now in this case we will examine the pulse. The radial pulse on the left side is palpable, and the radial pulse on the affected side is absent. Then ulnar, not palpable. Not palpable. Then you have to see brachial. First on the normal side. Brachial is palpable. Brachial is palpable on both sides. Then you see for dorsalis pedis and posterior tibial. Peripheral. First on the normal side. Feeble है. It is feeble on both sides. Then you see for local temperature. Local temperature. This side it is cold. This side is warm. Not much change. So the lower limb, there is not much change in the temperature. Let us see the upper limb. This is warm and this is cold. Up to mid arm, mid forearm, it is almost equal. Below mid forearm, it is warmer on this side and colder on this side. And in both limbs, this side is warm, this side it is cold. Then आँख बंद करिए. Then you have to see for sensation. आँख बंद करिए. हम छुएंगे तो आपको बताना है, गिनना है 1 2 3. एक छुएंगे तो 1 2 इस तरह से बोलना है. बोलिए. एक बोलिए. एक बोलिए. हाँ बोलते जाइए. नहीं 3 बोलिए. 3 हाँ 4 हाँ 9 10 हाँ 8 9 10 11 12 13 14 15 16 17 18. So there are no loss of sensation. So there is no neuropathy. It is only a vascular compromise. ठीक है? आप खोलो. अभी बैठे रहो. So now we have some idea about the problem. That this patient has local vascular compromise. So now, why this local vascular compromise? The reasons are, it could be because of atherosclerosis and the blood clot migrates to that area and obstructs the vessel. So that is one reason. The other reason could be he's having some other, because he's a chronic smoker for a long time, there is also some changes in the blood vessels, which could be the reason. And this blackening is affecting, just focus here. Focus here, focus here.
Yes.
You see these few, the index finger, there is blackish discoloration of the tissues, and this finger also has some changes in the skin. Skin scoriation is there. There again, these two fingers are dry, but there is no gangrene. दूसरा हाथ दिखाइए. So only two fingers. This side is normal. This side is normal, and these two fingers are affected. So मेरा हाथ grip. We have to see the muscle tone. हाथ दबाइए. मुट्ठी बंद करिए. इसको भी बंद करिए. Muscle tone is also normal. So the only thing which is compromised is the vascular supply. Neurologic, there is no neurological deficit, there is no muscular deficit, there is only a vascular compromise. Since these vessels are small and medium sized, so there are two options. One is to start, first we have to investigate. So in the investigation, what we have to do, we have to get a color Doppler. So in the color Doppler, we will know where is the site, and only one vessel is affected or multiple vessels are affected, and what is the extent. So that can be picked up by a color Doppler. Then the second investigation is lipid profile. So we have to see what is the status of the yes, and then we have to see blood sugar. And of course, after that, we have to see RH factor and other autoimmune antibodies. We have to check. And we have to do an ECG, echocardiogram, and see for any cardiac changes. Because many times there is a small thrombus which goes from the heart and lodges in the blood vessel, causing obstruction. So you have to have a complete workup of his cardiovascular system, and you have to have a diabetic workup and lipid profile. So once you have all those things, then we will come to the close how to manage this patient. So the management will start with checking his blood sugar level. If he is diabetic, we have to put in anti-diabetic therapy. If it is having deranged lipid profile, we have to correct that. If there is any cardiac ailment, we have to manage that. Then coming to the local management. So there are certain medications which help the patient by giving, say, aspirin, which is it makes it more thinner, blood thinner. That is going to help. Then Trental Fort, yes, which helps in mild vascular dilation and opening of the collateral channels. So that helps in this patient. And after that, we have to also do what you call vascular surgery, if at all it is required. We have to control the pain which he is having, and if by medication he withdraws and the gangrene does not spread. Since it is a dry gangrene, there is no hurry in amputation. But if it was a wet gangrene, we would have decided about amputation. So let it be like this for 2 more days till we complete the investigation. And then we start on treatment for pain and just mild physical activity. And then hope for the best. Once this diagnosis, whether it is a cervical rib or whether it is Pemphigus syndrome or it is peripheral arterial disease or there is a cardiac ailment or it is diabetes or it is an autoimmune disorder. So once we solve that riddle, then the final treatment will be decided. Otherwise, it is symptomatic treatment as of now. Regarding bypass surgeries, that is for major vessels. It's a very small, medium-sized artery. there is no need for a bypass vessel as of now. But once we get the color Doppler, we can decide and we can discuss with the vascular surgeon whether the feasibility of that procedure is there. As a general surgeon, then now there is no specific treatment except for just taking care of his limb, controlling his pain, and giving him drugs which will conservative, and just counseling of the patient that he has to stop smoking and take any form of tobacco so that the disease does not progress. Thank you very much.
Thank you.